Assalamu alaikum. I am Mariam Saeed from final year. My roll number is BP1650130. My topic for the presentation is the drug digoxin. Now first, what is digoxin? Digoxin is the cardiac glycoside. All of the cardiac glycosides or cardenolides of which digoxin is the prototype. It is obtained from Digitalis lanata. Digoxin has multiple direct and indirect cardiovascular effects with both therapeutic and toxic consequences. Digoxin has undesirable effects on central nervous system and as well as on the gut. It is the only cardiac glycoside that is used in the USA and is about 65 to 80% absorbed after the oral administration. The therapeutic range in the serum should be about 1 to 2 microgram per liter because the digoxin has a very narrow therapeutic range and the toxic effects are seen when the level is greater than 2 microgram per liter. Rational and intended use of digoxin. Digoxin is indicated for the treatment of mild to moderate heart failure in adults. Digoxin increases myocardial contractility in pediatric patients with heart failure and used for the control of ventricular response rate in adult patients with chronic atrial fibrillation. Rational use of digoxin. The rational use of the drug include chronic atrial fibrillation, chronic heart failure, and isolated right ventricular failure that is not responsive to conventional therapy. Anti-failure regimen, that is ACE inhibitors, beta blockers, and diuretics with depressed EF. Here EF means ejection fraction. Irrational use of digoxin. Here are some diseases in which we can use digoxin, but there is the irrational use that means rheumatic heart disease, hypertensive heart disease, COPD with acute exacerbation, CKD means chronic kidney disease, WPW syndrome, Wolff Parkinson White syndrome, AV block, sinus bradycardia, myocarditis, and acute rheumatic fever. Digoxin dose adjustment. Recommended oral loading dose include administer half the total loading dose initially, then 1/4 of the loading dose every 6 to 8 hours twice. 20 to 45 microgram per kg for 5 to 10 years, 10 to 15 microgram per kg for adults and pediatric over 10 years. Recommended maintenance dose in adults and pediatric over 10 years old, 3.4 to 5.1 microgram per kg per day once daily. Reduce the dose of digoxin in patients whose lean weight is an abnormally small fraction of their total body mass because of obesity or edema. No adjustment of dose required in hepatic impaired patient. Drug interactions. Here are some drugs which interact with the digoxin. Like first one is P-glycoproteins. P-glycoprotein inducer and inhibitors. Drugs that induce or inhibit P-glycoproteins have potential to alter digoxin pharmacokinetics. Pharmacokinetic drug interaction. Digoxin concentration increases greater than 50% in the presence of captopril, gentamicin, and verapamil, etc. And digoxin concentration increases less than 50% in the presence of carvedilol, quinine, and diltiazem, further etc. Digoxin concentration decrease in the presence of A-carpose, antacid, etc. Here is the case study in which we can use the drug digoxin. A 45 years old man in sinus rhythm with an ejection fraction of 20%, normal coronaries, and normal renal function is receiving captopril 50 mg 3 times daily, carvedilol 25 mg, and furosemide 40 mg twice daily, and spironolactone 25 mg daily. Despite these therapies, he continues to complain of dyspnea with minimal exertion. There are jugular venous distension, rales, and ankle edema. Oral digoxin further added to the in this regimen for in about dose of 0.125 mg daily. Subjective chief complaint includes 20% ejection fraction that shows cardiac heart failure. Because the normal range of ejection fraction is between 50 to 70%, and under the range of 40%, that means the muscle is weakened and person may have heart failure. 20% ejection fraction means about one third of the normal ejection fraction. It is severely impaired patient, and if further decreases the ejection fraction to less than 15%, this means that the person is at the end stage and he required transplant of the heart. History of the present illness: sinus rhythm, dyspnea, jugular venous distension, rales, and ankle edema. Medical history: patient taking captopril 50 mg 3 times daily, carvedilol 25 mg, and furosemide 40 mg twice daily, and spironolactone 25 mg daily. Objective: vital signs: ankle edema, rales, venous distension, and dyspnea while minimal exertion. Assessment: while patient is taking combined therapies for the cardiac heart failure, instead of this, his condition is worsening, so we add digoxin, that is digitalis glycoside, further in this regimen. Differential diagnosis: person is severe cardiac heart failure patient, or he may also have exudate or transudate. Plan: diagnostic plan: we have to perform ECG, MRI, and nuclear stress test to check the condition heart failure and to calculate the ejection fraction. Treatment plan: we add digoxin 0.125 mg daily in above mentioned combined therapy for medication. After 3 weeks of maintenance therapy with digoxin, the patient feels much better. Here is the mechanism by which digoxin treats the cardiac heart failure patient. Digoxin binds to the sarcolemma sodium-potassium ATPase pump, thereby blocking sodium extrusion outside the myocyte in exchange for the potassium, progressively accumulating sodium ions inside the sarcoplasm lead to a secondary increase in the intracellular calcium concentration as the sodium-calcium exchanger promotes calcium influx over efflux. Calcium is transported into the sarcoplasmic reticulum, where it is stored during diastole. When the next depolarizing impulse reaches the myocyte, a greater quantity of calcium is released, resulting in a more forceful contraction during excitation-contraction coupling. Digoxin toxicity: as we know that digoxin has a very narrow therapeutic range. It is usually associated with levels greater than 2 microgram per milliliter. The signs and symptoms of digoxin toxicity include anorexia, nausea, vomiting, visual changes, thirst, degree of heart block. It may produce arrhythmias, conduction disturbances, supraventricular tachyarrhythmias, and multiform ventricular premature contraction. Digoxin toxicity has declined, possibly as a result of a decreasing use and a reduced recommended therapeutic range. It can occur when a serum digoxin concentration is within the therapeutic range, and as the presenting features are usually non-specific, the diagnosis can be difficult. Digoxin-specific antibody fragments are used when there is a risk of life-threatening arrhythmias. Here are some alternative brands of digoxin, like XARELTO, metoprolol. Digoxin available in the form of injectable solution, oral elixir, oral tablets, and XARELTO includes in the form of available in the form of oral kit, oral tablets, and metoprolol available in the form of injectables, tablets, and capsule. The mechanism of action by which the digoxin acts, that it is group 5 antiarrhythmias, inotropic agents. Xarelto is the factor 10 inhibitors, and metoprolol is the cardioselective beta blockers. Digoxin is prescribed for atrial fibrillation and heart failure. Xarelto is prescribed for the atrial fibrillation, deep vein thrombosis, coronary artery disease, etc. Metoprolol is prescribed for angina, tapering regimen, high blood pressure. Here are some references by which I made my whole assignment. Thank you. Allah Hafiz.